Hello there! Hello nurses and hello world! This is nurseniezl and welcome back to my channel.
This video is solely for demonstration purposes as interpreted by the actor based on her understanding of the specific skill with reference to the Royal Marsden Manual of Clinical Nursing Procedure 10th edition. All information presented are public domain materials accessible through the relevant governing organizations' websites. Subtle similitude may be noticeable, however, this is not intended to be definitive guide to the NMC Part 2 Test of Competence or the OSCE examination. This can be a helpful material for overseas or internationally trained nurses to learn and adapt to the UK clinical settings and transition effectively into practice.
So you all know what we're going to do today. It's about VIP or Visual Infusion Phlebitis or VIP score and IV cannula flashing. Okay? This video is the part 2 of the VIP assessment and IV cannula flashing. If you have not watched the part 1 at all, you won't be able to understand this video. So go ahead and watch the part 1 to understand and to know what the VIP assessment is all about. But before we get into it, give this video a like and subscribe to my channel. Also, if you want to get notified just in case I post more OSCE videos, then hit the notification bell. Also, comment down below what other videos you want me to do next, okay? VIP score and IV cannula flashing is one of the new skill stations in the OSCE exam. You have to do this procedure within 12 minutes. And that's what I'm going to show you all today. In order for you to pass, you have to administer the IV medication safely. Yes, you heard me. IV flashing here in the UK is an IV medication administration. That is why it has to be prescribed. You have to remember our 5 R's, the 5 rights of the patient when it comes to administering medication or when it comes to taking their medication. Right patient, right medication, right route, right dose, and the right time. So remember to do your full ID check. You must also complete the documentation in the prescription chart. You will receive different prescription charts, okay? It depends on where you are, whether you're in a hospital or you're in the community. We've come now to the favorite part of this video. We're gonna do the live simulation. Are you ready? Let's go! So with this station, you have got 12 minutes. You will be given a prescription since we are doing a hospital prescription. So it looks like this, okay? It looks like your implementation prescription, okay? It's the same as the same booklet, all right? Also, you will be given a picture in which that is the condition of your patient. If you could have a look at this one. So we've got now a situation. This is now the picture in which we have to determine the VIP score of the patient. Also, the VIP scoring, I advise for you to memorize this, okay? Just in case it's not on the exam center. If it is, then good for you. You're lucky. But if it's not, then at least you already have it in you, okay? You have to memorize this, alright? Alright, the first thing I'm gonna do is to wash my hands using the 6 steps of hand washing. First, I'm gonna wet my hands. Get some soap. With 5 backward and forward stroke from palm to palm. Right palm over the left torso and vice versa. Fingers interlaced. Fingers interlocked. Rotational rubbing of the thumb and vice versa. Rotational rubbing of your finger clasp and rotational rubbing of the wrist. Rinse it thoroughly with water. And then pat it dry with clean towels. Dispose it in the domestic bin. Pat it dry. And again, there you go. That's how you wash your hands using the 6 steps of hand washing according to the World Health Organization. After washing your hands, you have to check the prescription. So let me just check the prescription. So this prescription is for Ashanti. She's been admitted in the medical ward. She is due for intravenous flash. All the equipment you need is provided. Please administer and complete the documentation in this prescription in a safe and professional manner. Assume it is today and it is 12 noon, okay? 1200 hours. So I'm gonna read the prescription now. This prescription is for Ashanti Smith. Date of birth is 1st of the 4th, 1987. Hospital number is N111222. She's in a medical ward. Date of admission is today. Time of admission is 10 in the morning. The height is 5'3". The weight is 68 kilograms. The body surface area is 1.80. So, the name of the prescriber is Dr. Nicole Consi. GMC NMC number is 123456. Signature is present and the blip number is 123. So, the patient is allergic to penicillin and she's got rashes as an allergic reaction. So, the signature of the doctor is here, Dr. Nicole Consi. Blip number is 123. That is, the date is today. And obviously, there's no other details that is present in this side. So, I'm gonna flip the page. Again, this prescription is for Ashanti Smith. The information and the patient details are correct and complete and the same as the first page. So, the first one here as the once and only, nothing is in here. So, I'm gonna find it. Nurses, I know this looks like the implementation station prescription, but you don't need to read all of them, okay? Just read the first pages in which the patient details and the likes, okay? But you don't need to necessarily read all the pages. Just find the IV cannula prescription, okay? So, this is now the antimicrobials, which is an oral medication. Okay, PRN as required. Okay, here we are now. So, we've got the infusion, okay? So, as you've seen, I'm going to put it in the screen at the same time. So, it is said here as an infusion. The date is today. The name of the fluid or the infusion is 0.9 sodium chloride. The volume is 10 ml. Route or route is IV. Frequency is once a day. There's a prescriber signature, Dr. Nicole Consi. Blip number is 123. So, I can confirm that the patient is prescribed of 0.9 sodium chloride 10 ml as an IV flush, okay? I'm gonna prepare now the equipment needed. I'm gonna prepare all the articles that I needed, okay? So, Miss Examiner, is this tray disposable or non-disposable tray?
That one is disposable.
This is a disposable tray as confirmed by the examiner. So, I'm gonna prepare now all the things that I needed. Okay, so the first one I got here is the 0.9 sodium chloride pre-filled syringe. Expiration date is 04/2025. It's clean and intact. There's no precipitate. So I'm going to compare it with my prescription. 0.9 sodium chloride, 0.9 sodium chloride. So I'm going to put it in my tray. The next one is... So the next one I got here is 70% chlorhexidine alcohol swab. Expiration date is 06/2023. Clean and intact. So I'm going to put it in my equipment. The next one is... I got here the drape. So it's clean and intact. So these are all the things that I need. I'm gonna gel my hands, let it dry for 30 seconds. I let it dry for 30 seconds. I got here my apron. Get some gloves. Okay, let me just gel my hands. Let it dry for 30 seconds. I'm now gonna go to my patient. So I'm gonna go now to the patient side. So take the tray together with the prescription to the patient side. Hello! So, let me just gel my hand. Hi, I'm nurseniezl. How are you? Are you alright?
I'm okay.
And I'm here because I need to do a
VIP assessment and
IV flushing on your IV cannula. Is that okay?
Yes.
Okay, so but before I start this, would it be okay if I just check your ID?
Yeah, sure.
Okay, let me just wear my glove. Okay. Okay. Would it be okay if I touch you? I just need to compare your prescription on the wristband, if that's alright.
Yeah, sure.
Okay, can I have a look? Can you tell me your full name, please?
Ashanti Smith,
And your date of birth?
1st of the 4th, 1987.
Okay, and the hospital number is N11222 and 11222. I can confirm that it's the same patient. I can see that you're wearing a red wristband. Do you have any allergies to food, medication, or latex?
I'm allergic to penicillin.
Oh, penicillin. I can see from your red wristband that you're allergic to penicillin. And what kind of allergic reaction you get from that?
Rashes.
I can confirm that the patient is allergic to penicillin and the adverse reaction is rashes. Thank you. Alright, thank you so much. So are you alright? Are you comfortable?
I am comfortable.
Okay, do you want me to reposition you or anything?
No, I'm okay.
Alright, okay. So would it be okay if I proceed?
Yeah, sure.
Okay, before I start, what do you want me to call you?
Just call me Ashanti.
Okay, Ashanti. Okay, thank you. So the first thing I'm gonna do is to do a VIP assessment, if that's alright with you. I just need to assess your cannula at the moment, okay? Would it be okay?
Yeah.
At this point, nurses, remember that you will be given a picture of the visual infusion phlebitis in which you need to VIP assess, okay? But if there's no picture given to you, then assess the IV cannula site itself, okay? Good? Alright, so I'm gonna start now. So, Ashanti, I can see that the IV cannula site is swollen. Okay, there's also an erythema around the cannula site. Ashanti, can I just ask, do you feel any pain on the cannula site?
Yes, I can feel pain along path of the cannula.
So the pain is along the path of the cannula, you say?
Yes.
Okay, so I can confirm that there is pain. Since you said you've got pain alongside of the cannula, can you please score the pain from 0 to 10? 0 being no pain and 10 being the worst?
Around 4?
4 out of 10?
Yeah.
Okay, do you want any pain relief at all?
No, I'm okay, nurse.
Okay, since the patient doesn't want any pain relief, I'm not gonna do anything about it. I'm just gonna go on with the procedure, okay? Should the patient ask for pain relief, I'm gonna ask the examiner that I'm not gonna go with the procedure without giving it, okay? So, Ashanti, since you said you don't want any pain relief, would it be okay if I just go with the flushing?
Yeah, sure.
Okay, can I just ask? I can also see a palpable venous cord right here. So I just need to ask, Miss Examiner, what's the temperature of the patient?
36.5.
So 36.5. The patient doesn't have any pyrexia. So I can confirm that the VIP score of the patient is 4. That being said, this is now an advanced stage of phlebitis or the start of thrombophlebitis. Miss Examiner, at this point, I'm not gonna flush the cannula. What I'm going to do is to resite this cannula, okay? I need to reposition this cannula elsewhere, and I need to consider treatment for the IV phlebitis.
The cannula has been recited.
Okay, since the cannula has now been recited, I am now going to give the IV flush, okay? So, how's your new cannula at the moment? How does it feel? Are you alright? Are you comfortable? Is it now okay?
Yeah, it's okay.
Alright, so now I can confirm that the IV cannula is recited, so I'm gonna give you the IV flush, okay, of sodium chloride pre-filled syringe, okay? I'm gonna get the drape. So nurses, here's the tip. I'm gonna prepare first the syringe because later on, once I've touched that port, I can't remove my hand in there. Okay? Now, I'm going to clean the port right here. Okay? Open your swab. Now, once you hold this port, you can't remove your hand anymore. This hand anymore. Okay? So, within 30 seconds, you have to clean the port.
These are the examples of ports or bioconnectors used in the hospital setting. Please familiarize yourself with all of them. Please do not remove any port or bioconnectors connected on the patient's IV cannula port.
So assuming it's now 30 seconds, let the port dry for 30 seconds. Now, I'm going to connect the pre-filled syringe to the port using a septic non-touch technique. As you can see, right here, I am not going to remove my hand. Okay, once I put this hand here, I'm not gonna remove that one. Okay, now I'm gonna start flushing the cannula using a pulsating action or a stop and start procedure. Okay, so start, stop, start, stop, stop. Also, in this part, while doing the flushing, you have to ask the patient in between the flushing whether any pain or discomfort is experienced while flushing. Okay, again. Start, stop, start, stop. Are you okay? Are you alright?
Yes, I'm okay.
Is there any pain?
No pain at all.
Okay. Start, stop, start, stop, start, stop, start, stop. Is there any pain?
No pain at all.
Start, stop, start, stop. Is there any pain?
No pain at all.
Okay. Start, stop, start, stop. Now, the last one, start, stop, and I'm gonna and this is the time I can let go. Okay, so that's it. I'm gonna put it here. Okay, now I'm gonna remove the. Are you alright?
Yes, I'm okay, nurse.
Okay, so I'm gonna remove the drape. And everything on my tray are disposable, including the tray. So I'm gonna put it on the clinical waste bin. And my gloves. Remove my apron. Next is to gel my hands. Then let it dry for 30 seconds. Now, I need to ask the comfortability of the patient. Ashanti, are you comfortable?
I am comfortable.
Do you have any pain at all?
No pain at the moment.
Okay, so would it be okay? Let me just document, yeah?
Yeah.
Okay. Kneel. Kneel. Okay, this one is right here. COD, pharmacy check given by. Okay, check by. Start time is 12. Volume given 10 ml. Okay, and 8. Okay. So I am done with the documentation. Ashanti, I'm now finished with the documentation, so I've charted what I've given to you, which is your 0.09 sodium chloride pre-filled IV flush. So I'm done with that. Are you comfortable right now?
Yes, I'm comfortable.
Okay, so do you have any other concern for me?
No, I'm okay.
Okay, so if there's any other concern, I give you here the call bell. If you need anything, just give me a call. Thank you so much for today. I'm gonna go now, alright?
Alright, thank you.
Okay, let me just gel my hands again. And later on, Miss Examiner, I'm gonna wash my hands using the 6 steps of hand washing after the procedure. And that's the end of the procedure. I hope you learned something for today. If you are about to take your OSCE exam anytime soon, good luck and I wish you all the best. So please, if you like this video, please give this video a like and subscribe to my channel. Also, if you want to get notified just in case I post more videos, then hit the notification bell. Comment down below what you liked about this video and what you don't like about this video. Also, comment down there what other OSCE videos you want me to do next. This has been nurseniezl and see you on the next one. Bye!
Good morning.